Like and subscribe for daily OT brain boosters. When a client pinches the ends of the pinch gauge between the tips of the thumb and index finger with the index finger on the dial side, fingertips stopping at the finger groove as if making an O, thumb and index IP joints flexed, and the middle, ring, and little fingers flexed into the palm, what type of pinch test is being demonstrated? C. Tip pinch. The client pinches the gauge between the pad of the thumb and the radial side of the middle phalanx of the index finger. The thumb is on the dial side and must stop at the finger groove, and the IP joint of the thumb must be flexed. The remaining fingers are flexed in the palm. What type of pinch is the therapist testing? A. Lateral pinch, key pinch. When the gauge is held at about 45 degrees between the thumb pad and the pads of the index and middle fingers, with IP joints slightly flexed and the other fingers in the palm, which type of pinch is not represented? B. Lateral pinch. Context. In this question, the client is demonstrating a palmar pinch, also known as a three-jaw chuck pinch. Which two are the components of measuring endurance when treating a variety of conditions that impact the individual? A. Cardiorespiratory, CR, endurance, and muscular endurance. Which term is defined as the ability of the circulatory and respiratory systems to supply oxygen during a task? C. Cardiorespiratory, CR, endurance. Which scale allows a person to assign one of a consecutive set of numbers with a corresponding descriptor of exertion to an ongoing activity, and although subjective, multiplying the rating of exertion by 10 can provide a rough estimate of heart rate? B. Borg rating of perceived exertion, RPE scale. When measuring the number of repetitions per unit of time for muscle endurance, this is known as which type of assessment? B. Dynamic assessment. When measuring muscle endurance, if the assessment consists of the amount of time a contraction can be held, this is known as what type of assessment? A. Static assessment. Like, comment, and share your thoughts to help us grow and learn together. Learned something or nailed it? Follow us to stay OT sharp. You got this.